The fluorescent lights buzzed overhead like angry wasps as 8-year-old Emma Martinez writhed on the emergency room floor, her high-pitched screams cutting through the sterile air like shattered glass. Her mother Sarah knelt beside her, tears streaming down her face as she tried to calm her daughter's trembling body, while her father Miguel paced frantically between the triage desk and his family, his voice cracking with desperation. "Please, someone help her. She's in agony." Sarah's voice echoed through the waiting room, drawing uncomfortable stares from other patients who shifted in their plastic chairs. Emma's stimming had intensified to violent rocking, her small fists beating against her temples as she let out another soul-piercing wail that seemed to come from the deepest part of her being. Behind the triage counter, Karen Thornfield adjusted her reading glasses and pursed her lips. Her 23 years of nursing experience evident in the practiced way, she dismissed what she considered theatrical behavior. At 52, Karen had seen it all, or so she believed. Her steel-gray hair was pulled back in a tight bun that seemed to stretch her already severe features, and her pale blue scrubs bore not a single wrinkle despite the chaos unfolding mere feet from her station. "Ma'am, you need to get your daughter under control." Karen's voice cut through Emma's cries with the sharpness of a scalpel. "This is a hospital, not a playground. Other patients are trying to rest." Miguel's hands clenched into fists at his sides as he approached the desk for the 4th time in 20 minutes. His work shirt, stained with motor oil from his auto shop, clung to his chest as he struggled to maintain his composure. "My daughter has autism. She doesn't express pain the way other children do. Something is seriously wrong with her, and you people won't even examine her." The morning had started like any other Tuesday. Emma had eaten her usual breakfast of plain toast, cut into precise triangles, arranged her collection of smooth river stones in order of size, and settled into her routine of watching the same educational video about marine life that she'd memorized word for word. Sarah had been folding laundry in the next room when she heard the crash, followed by a silence so complete it made her blood run cold. She'd found Emma collapsed beside her bedroom dresser, the heavy wooden furniture slightly askew, her daughter's face contorted in a mask of agony, unlike anything Sarah had ever witnessed in 8 years of motherhood. Emma's usual verbal communication, already limited by her autism, had dissolved entirely into primal screams that seemed to come from somewhere deeper than physical pain alone. The drive to Riverside General Hospital had been a nightmare of Emma's escalating distress, her screams growing more desperate with each traffic light, each turn that seemed to intensify whatever internal torment was consuming her small body. Miguel had run 3 red lights, his knuckles white on the steering wheel, as Sarah held Emma's convulsing form in the back seat, whispering desperate prayers in both English and Spanish. Now, 47 minutes after their arrival, they remained in the same waiting room purgatory, watching their daughter suffer while bureaucracy and prejudice formed an impenetrable wall between Emma and the medical care she desperately needed. "Look at her." Sarah's voice broke as she gestured toward Emma, who had begun hitting her head against the cold linoleum floor with mechanical precision. "Does this look like normal behavior to you? Does this look like something a child would fake?" Karen's expression remained unchanged, her fingers drumming impatiently against her clipboard. Children with behavioral issues often engage in attention-seeking displays. I've seen this type of performance countless times. What your daughter needs is discipline, not medical intervention. The word performance hung in the air like a toxic cloud, and Miguel felt something snap inside his chest. His voice, when it came, was barely controlled thunder. Performance. My daughter is not performing anything. She's 8 years old, and she's suffering. Karen's pale eyes narrowed as she leaned forward slightly. Sir, I'm going to need you to lower your voice. If you continue to be disruptive, I'll have to call security. In the corner of the waiting room, an elderly woman named Dorothy Hendricks watched the scene unfold with growing unease. At 74, Dorothy had raised 6 children and worked as a substitute teacher for over 30 years. She recognized genuine distress when she saw it, and everything about the small girl on the floor screamed of authentic medical emergency, not behavioral manipulation. "Excuse me," Dorothy said quietly, approaching the family with careful steps. "I'm a retired teacher. I've worked with many children on the autism spectrum. This child is not misbehaving. Something is medically wrong." Karen's head snapped toward the elderly woman with the velocity of a striking snake. "Ma'am, unless you have medical training, I'd appreciate you not interfering with hospital protocol." Dorothy straightened her shoulders, her voice gaining strength with each word. "I may not be a doctor, but I know when a child is in crisis. This little girl needs immediate medical attention, not judgment." The tension in the room became palpable as other patients began to take notice. A young mother, clutching her toddler's hand, whispered something to her husband, who shook his head in obvious disgust at the scene playing out before them. An elderly man lowered his newspaper. His weathered face creased with concern as Emma's cries reached a new pitch of desperation. Sarah's hands shook as she tried once again to comfort her daughter, her voice breaking into fragments. "Emma, baby, Mommy's here. Please, sweetheart. Try to tell me where it hurts." But Emma was beyond communication now, lost in a world of pain that her neurodivergent mind couldn't process or express in ways others could understand. Her stimming had become violent self-harm, her fists striking her head with increasing force as her body convulsed with each wave of agony. "That's enough," Karen announced, standing abruptly from her chair. Her voice carried the authority of someone accustomed to absolute power within her domain. "I'm calling security to remove this family. They're disrupting the entire emergency department." Miguel's face went white with shock and rage. "Remove us! Our daughter needs medical care. You can't just throw us out." "Watch me," Karen replied coldly, already reaching for her phone. Within minutes, 2 security guards appeared, their presence imposing and unwelcome in the already tense atmosphere. Officer Bradley Martinez, no relation to the family despite sharing a surname, looked uncomfortable as he assessed the situation. At 28, he'd been working hospital security for only 6 months, and something about this scene felt fundamentally wrong to him. The child on the floor was clearly in distress. Her parents were desperate rather than aggressive, and the entire situation seemed to stem from a lack of compassion rather than any real security threat. "Ma'am," Officer Martinez addressed Karen carefully, "what exactly is the issue here?" Karen's voice took on the clipped, professional tone she used when asserting her authority. "This family is being disruptive. The child is engaging in behavioral acting out, and the parents are refusing to control her. They need to be removed from the premises immediately." Officer Martinez looked down at Emma, whose small body continued to writhe in obvious agony, and felt his stomach turn. "Has the child been medically evaluated?" "There's nothing medically wrong with her," Karen replied with certainty that bordered on arrogance. "I've been doing this for over 2 decades. I know the difference between genuine medical emergency and attention-seeking behavior." The second security officer, an older man named Thompson, seemed less conflicted about the situation. "Folks, you need to gather your belongings and leave the premises. If you return, you'll be arrested for trespassing." Sarah's world began to crumble around her as the reality of the situation sank in. Her daughter was suffering, possibly dying, and they were being forcibly removed from the only place that could help her. "Please," she whispered, her voice barely audible above Emma's continued screams. "She's just a little girl. She can't help how she expresses pain." Dorothy stepped forward again, her voice sharp with indignation. "This is absolutely shameful. You're denying medical care to a child based on prejudice and ignorance." "Ma'am, please step back," Officer Thompson warned, his hand moving to his radio. "Don't make this situation worse than it needs to be." As Miguel knelt to lift his daughter from the floor, Emma's body went rigid for a moment before she vomited violently across the linoleum. The contents of her stomach mixed with what looked suspiciously like blood. The sight stopped everyone in their tracks, the bright red spatters against the white floor providing stark visual evidence that something was terribly, dangerously wrong. "Oh my God," Sarah gasped, her hands flying to her mouth. "Emma, baby." But Karen remained unmoved, her expression hardening further. "Clean that up and get them out of here. Some children will go to extreme lengths for attention." The callousness of the statement sent shockwaves through the waiting room. Several patients stood up, their faces reflecting mixtures of horror and disbelief. A middle-aged businessman pulled out his phone and began recording, his voice carrying clearly across the room. "Are you seriously going to deny medical care to a child who just vomited blood? What kind of hospital is this?" Officer Martinez's face had gone pale, his training in conflict with what his conscience was telling him. "Ma'am, maybe we should have a doctor take a quick look at the child, just to be safe." Karen's response was swift and definitive. "Officer, I am the medical professional here, and I'm telling you that child does not require medical intervention. Your job is security, not medical assessment. Please remove this family immediately." The bureaucratic weight of hospital hierarchy pressed down on the young security officer like a physical force. Despite every instinct screaming that this was wrong, he found himself nodding reluctantly. "Sir, ma'am, you need to leave now. You can seek medical care elsewhere." Miguel's voice cracked as he lifted his daughter's trembling form. "Where else can we go? This is the only emergency room for 30 miles. You're signing her death warrant." The accusation hung in the air like smoke from a funeral pyre, and several people in the waiting room began pulling out their phones, some calling family members, others beginning to document what they were witnessing. The elderly woman, Dorothy, followed the family toward the exit, her voice carrying clearly for everyone to hear. "This is a disgrace to the medical profession. You should be ashamed of yourselves." As the automatic doors of Riverside General Hospital slid shut behind the Martinez family, Emma's screams became muffled by the distance, but seemed to echo in the conscience of everyone who had witnessed the scene. Miguel carried his daughter to their car, her small body burning with fever that he could feel through her clothing, while Sarah fumbled with shaking hands to call their pediatrician's emergency line. "Doctor!" Rebecca Chen had been Emma's pediatrician since birth, and she knew the child's medical history better than anyone. When Sarah's frantic call came through at 11:30 that morning, Dr. Chen was between appointments at her private practice, but the desperation in the mother's voice made her drop everything immediately. "Bring her here right now," Dr. Chen commanded, her usually calm demeanor shifting into crisis mode. "Don't stop anywhere else. I'll be waiting." The drive to Dr. Chen's office took 18 precious minutes, during which Emma's condition continued to deteriorate. Her fever spiked higher, her skin taking on a grayish pallor that terrified her parents, and her screams gradually weakened into whimpering moans that somehow seemed even more frightening than her earlier distress. Dr. Chen met them at the door of her clinic, her slight frame moving with the urgency of someone who understood the gravity of the situation immediately. At 45, She had been practicing pediatric medicine for over 15 years, specializing in the care of children with developmental disabilities and autism spectrum disorders. One look at Emma told her everything she needed to know. "Get her into exam room 2 immediately," she ordered her nurse. "Call 911 and tell them we need an emergency transport to Children's Hospital downtown. This child needs surgery." As Dr. Chen's experienced hands performed a rapid but thorough examination, the full scope of Emma's medical emergency became terrifyingly clear. The child was showing classic signs of internal bleeding, likely from traumatic injury to her spleen or liver, compounded by the onset of sepsis that could prove fatal within hours if left untreated. "How long has she been like this, Doctor?" Chen asked, her voice tight with controlled urgency as she prepared IV medications. "Since about 8 this morning," Sarah replied, her voice hollow with exhaustion and fear. "We took her to Riverside General, but they wouldn't even examine her. The triage nurse said she was faking it for attention." "Doctor!" Chen's face went white with fury, her hands continuing their life-saving work, while her mind processed the criminal negligence that had nearly cost Emma her life. "They turned you away, without examination. Who was the nurse?" "Her name tag said Karen," Miguel answered, his voice cracking. "Karen Thornfield. I think." The name hit Dr. Chen like a physical blow. She had heard whispers about Karen Thornfield through the local medical community, stories of prejudice and incompetence that had been quietly circulated but never officially addressed. The woman had a reputation for dismissing patients she deemed undesirable, particularly those with mental health issues, developmental disabilities, or socioeconomic challenges. As the ambulance crew arrived to transport Emma to Children's Hospital, Dr. Chen made a decision that would change everything. She pulled out her phone and began documenting every detail of Emma's condition, creating a medical record that would serve as undeniable evidence of the hospital's negligence. But more importantly, she began making calls to colleagues, to the state medical board, and to a journalist friend who specialized in healthcare advocacy stories. If Karen Thornfield thought she could deny care to vulnerable children without consequences, she was about to learn otherwise. The ambulance ride to Children's Hospital was a blur of sirens, flashing lights, and medical professionals working to stabilize Emma's rapidly declining condition. Sarah held her daughter's hand, while paramedics inserted additional IV lines and monitored vital signs that painted an increasingly alarming picture. "BP is dropping," one paramedic called out. "Pulse is thready and rapid. We need to move fast." At Children's Hospital, the emergency team was already prepared for Emma's arrival. Dr. James Morrison, the chief of pediatric surgery, took one look at the diagnostic imaging and immediately ordered the operating room to be prepared. "This child has a ruptured spleen with significant internal bleeding," he announced to his team. "She's also showing signs of sepsis. We need to operate immediately." As Emma was wheeled into surgery, Sarah and Miguel found themselves in another waiting room, but this one felt entirely different from their earlier nightmare. Here, staff members brought them coffee, updated them regularly on their daughter's progress, and treated them with the compassion and respect they had been denied hours earlier. Meanwhile, Dr. Chen's phone calls were beginning to bear fruit. The journalist, Maria Rodriguez, from the local television station, had been investigating complaints about discrimination in healthcare for months, but had never found a case as clear-cut and egregious as Emma's story. "I want to interview the family as soon as the child is stable," Maria told Dr. Chen. "This story needs to be told. How many other families have been turned away by this woman?" The question haunted Dr. Chen because she suspected the answer would be disturbing. over the next several hours, as Emma underwent emergency surgery to repair her ruptured spleen and treat her sepsis. Dr. Chen began reaching out to other families in the community who had children with special needs. What she discovered was a pattern of discrimination and medical neglect that stretched back years. Family after family came forward with stories of Karen Thornfield dismissing their children's medical needs, turning them away from emergency care, and treating them with contempt and prejudice that bordered on criminal negligence. The Thompson family had been denied care when their autistic son broke his arm, with Karen claiming he was overreacting to minor pain. The Garcias had been turned away when their daughter with Down syndrome developed pneumonia, with Karen suggesting they seek care at a more appropriate facility. The list went on and on, a damning chronicle of discrimination that had been hidden behind closed doors and institutional authority. Emma's surgery lasted 4 grueling hours, during which Dr. Morrison and his team worked to repair the extensive internal damage caused by the dresser falling on her that morning. The furniture had struck her with sufficient force to rupture her spleen and cause significant bleeding, creating a medical emergency that required immediate intervention. "She's going to be okay," Dr. Morrison told the relieved parents as he emerged from the operating room. "We were able to repair the damage and stop the bleeding. But I have to tell you, if you had waited another hour or two, we might have lost her." The words hit Miguel and Sarah like a physical blow. The realization of how close they had come to losing their daughter because of one woman's prejudice and ignorance. As they sat beside Emma's hospital bed, watching her small chest rise and fall with the rhythm of the ventilator that was helping her breathe, they made a decision that would echo far beyond their family. They were going to make sure that what happened to Emma never happened to another child again. The next morning, as Emma began to show signs of improvement, Maria Rodriguez arrived at the hospital with her camera crew. The story she told on the evening news was devastating in its simplicity and power, showing security camera footage from Riverside General that captured Karen's dismissive treatment of the family and Emma's obvious distress. The response was immediate and overwhelming. The hospital's phone lines were flooded with calls from outraged community members, medical professionals expressing their disgust, and other families sharing their own stories of discrimination at Riverside General. Social media exploded with shares and comments, turning Emma's story into a rallying cry for healthcare reform and patient rights. Within 48 hours, the state medical board had launched an investigation into Karen Thornfield's conduct, and the hospital administration found itself facing a public relations nightmare that threatened the institution's reputation and accreditation. The security camera footage left no room for interpretation or excuse, showing clearly that a child in obvious medical distress had been denied care based on prejudice and incompetence. Karen Thornfield, meanwhile, seemed oblivious to the storm gathering around her. When hospital administrators called her into a meeting 3 days after the incident, she remained defiant and unapologetic, insisting that she had followed proper protocol and that the Martinez family had been disruptive and demanding. "I stand by my clinical judgment," she told the hospital's chief administrator. "That child was engaging in behavioral acting out, not experiencing a genuine medical emergency." The administrator, Dr. Patricia Wells, had been dreading this conversation, but knew it was inevitable. "Karen, the child nearly died from internal bleeding and sepsis. She required emergency surgery to save her life. Your clinical judgment was catastrophically wrong." Karen's face flushed red with anger and embarrassment. "How was I supposed to know children with autism don't communicate normally? They're always making noise and carrying on." The statement revealed the depth of Karen's ignorance and prejudice, and Dr. Wells realized that this conversation was being recorded for the investigation. Every word Karen spoke was digging her professional grave deeper. As the investigation progressed, more disturbing details emerged about Karen's history. Former colleagues came forward to describe incidents of discrimination and patient advocacy issues that had been quietly swept under the rug over the years. The hospital's Human Resources Department found complaints that had been filed but never properly investigated, creating a pattern of institutional failure that extended far beyond one nurse's prejudice. The legal ramifications began almost immediately. The Martinez family, represented by a prominent civil rights attorney, filed lawsuits against both Karen Thornfield personally and Riverside General Hospital for discrimination, medical malpractice, and violation of federal disability rights laws. The case was ironclad, with video evidence, medical records, and witness testimony that painted a clear picture of institutional discrimination. But the most significant changes were yet to come. Emma's story had touched something deep in the community's conscience, and people began organizing to ensure that systemic change would follow the outrage. Parents of special needs, children, medical professionals, and community advocates formed a coalition dedicated to healthcare reform and patient rights protection. Dr. Chen found herself at the center of this movement, her professional standing and medical expertise lending credibility to the cause. She worked tirelessly to draft new protocols for emergency room triage, focusing on training staff to recognize and respond appropriately to patients with developmental disabilities and communication challenges. The state legislature took notice of the growing movement, and within 6 months, Emma's story had inspired comprehensive healthcare reform legislation that would be known as the Emma Martinez Patient Protection Act. The law mandated specific training for healthcare workers regarding patients with disabilities, established clear protocols for emergency room triage, and created severe penalties for healthcare providers who denied care based on discrimination. Karen Thornfield's nursing license was permanently revoked by the state medical board, and she faced criminal charges for child endangerment and violation of civil rights. The woman who had wielded her authority like a weapon against vulnerable families found herself stripped of power and facing the consequences of her actions. Riverside General Hospital underwent a complete overhaul of its emergency department protocols, with mandatory training for all staff and new oversight procedures designed to prevent future incidents of discrimination. The financial settlements paid to the Martinez family and other affected families forced the hospital to confront the true cost of allowing prejudice to masquerade as medical judgment. Emma's recovery was slow but steady, her resilient spirit shining through even as she dealt with the trauma of her medical emergency. As she regained her strength, she became an unlikely symbol of courage and determination, her story inspiring healthcare reforms that would protect countless other children in the years to come. 6 months after that terrible morning when Emma writhed in pain on the emergency room floor, she returned to Riverside General Hospital for a special ceremony. The hospital had been renamed the Community Healthcare Center, and Emma was there to dedicate a new patient advocacy center that would ensure no family would ever again face the discrimination and neglect her family had endured. As Emma, now healthy and thriving, cut the ribbon on the new facility, her parents stood beside her with tears of joy and pride in their eyes. Their daughter had not only survived her medical crisis, but had become the catalyst for changes that would protect vulnerable patients for generations to come. The legacy of that morning would live on in the lives saved by better training, more compassionate care, and the understanding that every patient deserves dignity, respect, and medical attention regardless of their ability to communicate in conventional ways. Emma Martinez had suffered greatly, but her suffering had meaning, and her recovery had brought hope to families throughout the state. In the end, love had triumphed over prejudice, Compassion had overcome ignorance, and a small girl's courage had changed the world around her. The echo of her screams in that emergency room had become a rallying cry for justice, and the silence of her near death had been replaced by the powerful voice of reform and renewal.